Good morning, everyone. This is a short little video about the imaging appearances of multifidus muscle atrophy, fatty atrophy, and multifidus muscle dysfunction. What I'd like to show you here is the same patient, CT scan versus MRI scan. Obviously, the CT scan was done first, and the history is one of 10 years of relapsing and remitting low back pain, going through all of the symptom-based interventions over the years, being told that there's nothing serious, but all the while her quality of life is deteriorating and she's not getting better with all of the symptom-based interventions and exercise therapy, core strengthening, stretching, acupuncture, increasing potency of pain medication. And then eventually she's told that, it's because you're a bit overweight and that's why you've got back pain. So just stop doing things. And of course, when you stop doing things, your quality of life deteriorates. But yes, your back pain improves a little bit because the functional demands of your lifestyle are brought back into check with your ever decreasing functional capacity. So, in regards to the CT scan, now you can see on the CT scan that there is significant facet arthropathy or accelerated facet joint degeneration, which I prefer to call degeneritis because it's accelerated. It's not normal pain-free degeneration, it's accelerated degeneration. So really quite marked facet arthropathy there. And what you can see are these black holes within the deep multifidus fibers down here. And it doesn't look terrible, okay? It doesn't look terrible. It's certainly mild, maybe moderate. But when we go and get an MRI scan, which is why it's really important to get an MRI scan, I think, as long as you know how to interpret it and as long as you know you have a sound management strategy to address the findings that you see on the MRI scan. You can't just say you've got a disc bulge, that's normal, 80% of people have disc bulges and it's irrelevant. Like that's just harmful information for the patient. It doesn't help them in any meaningful way at all. What we're seeing here, again, you're seeing the accelerated facet arthropathy. Luckily, there's no significant neural impingement yet. But what we can see on the MRI scan very clearly, it's like absolutely severe multifidus muscle atrophy, fatty infiltration, fatty atrophy, just really flaky muscle fibers down here in those deep stabilizing, intersegmental stabilizing fascicles of the multifidus muscle. And you don't appreciate that as much on the CT scan. And as I go higher into the more stable regions of the spine, you can see that it's a little bit better, but still look great. As I come down low, look at those hiddly little fibers there. And those are the important ones, not really these general stabilizers out here. These are all the general stabilizers. They're nowhere near as important as the deep multifidus fibers, which are the intersegmental stabilizers. Okay, and as a consequence of the loss of multifidus muscle function, we have loss of intersegmental stability, and we have accelerating biomechanical stress on the facet joints, and that, believe me, is painful for the patient, and the cycle is then accelerated with a positive feedback loop, which makes everything worse. All right. I hope that makes a little bit of sense, and all the best. Talk to you next time.